Welcome to my reflective project video. For those who don't know me, my name is Jenin. I'm a 4th semester nursing student at UNCW, and I just spent the last semester working on the pediatric floor. And I knew even before I started this semester that I was really interested in doing peds, especially peds critical care. And I absolutely loved my semester in peds. I loved getting to know the patients, but I really enjoyed spending time specifically in the NICU and the PICU. So my patient that I wrote about in the NICU was a baby who was born at 23 weeks or 24 weeks, very early on. Had been in the NICU for about a month and a half, was just working on growing, getting bigger, building up stronger lungs, feeding, just monitoring their condition, making sure they were progressing. And I actually got to see that patient multiple times this semester between different rotations in the NICU and working with different nurses. So that was really awesome to be able to watch that patient go from this like 1.5 pound baby to a 2.5 pound baby over the course of the semester. So that was awesome. The other patient I spent a lot of time with was based in the PICU, and this patient had been there for 5 months. I got to meet the parents a couple times, and they were both really sweet. This patient had heart condition, lung condition, digestive problems, neurological things. Like they had it all. It was just really awesome just to watch these kids get better. And even though I couldn't physically talk to them, or I could talk to them, but I couldn't have a conversation with them, I just felt so connected to these little tiny humans who just needed so much love. And I just think the reason I feel so drawn to these critical care infants is I was one of them. I spent the first 3 months of my life in the NICU and PICU and had a major surgery at 3 months old. So obviously I do not remember any of that, but I do know 2 people who do. So here they are.
I'm Cindy Barnes and this is John. We are Jenin's parents. When Jenin was born, everything, the normal delivery and stuff, but when she came out, she had this tumor right here in the middle of her eyes. The pediatrician on call was very good. He noticed something and he suggested that we have a CAT scan done shortly after she was born. As new parents, we were taken back because we had no indication during the pregnancy that there was any issues with the possibility of this happening. Of course, they went and had the CAT scan done shortly, hours after she was born, and they realized that it was a body mass of tissue and not necessarily like a cancerous type tissue. However, it had to be removed because it was going to cause her to be cross-eyed, and they weren't sure if it was going to continue to grow. And next thing you know, we had appointments for a cardiologist, a plastic surgeon, a neurologist. And as new parents, that was a bit overwhelming. We were just a little freaked out. I mean, I can't tell you how many mornings I would just cry. And we realized then that Jenin had a heart murmur, and that was something else they had to consider with doing this procedure they were looking at. I mean, just the thought that, you know, what he was going to have to do with this little baby who was, you know, just a couple months old by the time they had the surgery, you know, to go in and cut her from ear to ear, pull down her scalp, remove this tumor, build up her bridge of her nose where the tumor was removed. It was just a bit overwhelming. We just couldn't imagine that this is going to happen to this little tiny baby girl. That morning to have her procedure done, I mean, the staff there was very comforting. You know, they understood, they were very compassionate. When Jenin came back from having the surgery, her poor little eyes were swollen shut. She couldn't even see. Her head was wrapped in, you know, gauze and everything because of the procedure that was done. Even though she couldn't see us because her eyes were swollen shut, she could hear us talking and comforting her through this. But the staff was really good because they were very attentive, not just to obviously the baby's needs, but the needs to us. I mean, because, you know, if we, you know, had a concern about something, you know, especially like when we knew that there would be swelling, but we didn't know she wouldn't be able to open her eyes. And that was a concern for us. And they assured us that, you know, this is normal, that, you know, in you know, a couple of days, maybe even less, that, you know, once the swelling went down, she would be able to see. I mean, when she would cry, you know, we would have to literally like scoop her up because her head weighed more than her whole body at that point. even though she had staples going from ear to ear, they were so kind not to like cut all of her hair off because she had so much hair. So it looked like a little silver headband going across her head. She probably had close to like almost 50 staples, you know, going that way. And they just gently, you know, popped them all out. When you have a baby like that is sick, that, you know, the team that takes care of it from beginning to end, from pre-op to procedure and to the after operation, that the recovery area, that they took care of all of us through that time. There, you know, if I had a question, they were quick to answer. You know, if I needed something, they would provide it. It just meant a lot to have a supportive team that would help not only take care of a little baby, but the family that is so concerned and worried about that little baby.
Dad, you got anything to add?
No.
So like my parents mentioned, this was a very crazy time for them. They were first-time parents, and then their kid comes out with a fat tumor on their face. So not a fun time. But I think the reason I've always been so drawn to critical care is I want to be that nurse and that person who takes care of those little babies and takes care of those families who are going through such a drastic change in their life. That's just always been something that I've been interested in, and spending time with those infants really one-on-one and spending time with their families really helped confirm that for me, and I'm really grateful for this experience. And I think long term that was the reason that I was born the way I was born, so I could be able to relate to those families and relate to those kids. And I'm really, really excited to hopefully pursue a career as a critical care peds nurse. So thank you so much for watching. I really appreciate it.